Power Up Nursing, an omni-channel platform for more than 120,000 nurses in the United States and growing, with collaborations and partnerships with tech companies, hospitals, nurse organizations, and of course, patients, people themselves. Today I want to talk to you about our heart. And it is kind of very noisy here. I mean, I didn't know what to expect when invited to the Health 2024 conference, but I certainly am overwhelmed by the future of digital healthcare. If I am overwhelmed, I can only imagine what the average nurse, doctor, and most importantly, patient is. I want to start my discussion this morning with this question: who really is at the heart of what we're all striving to do? And that is the patient. And the patient's not here. And for just a few moments, I want to represent the human values that should drive everything that we all do in the name of health and well-being in the United States and around the world. I chose to put this slide up today that says obesity, medicine, and heart failure. Why? Because those are the kinds of titles that catch the eye of doctors, nurses, and patients. Not things like systems and operations, and certainly not artificial intelligence. I'm not being pessimistic towards the AI-leveraged healthcare world, but I am telling you from where I sit, working 3 days a week with patients who are years away from death due to heart failure, that the last thing they want is artificial intelligence. The last thing they want is an app to tell them what to eat. What they want is something that feels human. What they want is human connection, and they want to be empowered by the human heart behind healthcare. I can't tell you enough how much the nurses that are gathered in the Nurse Hackathon, or they would be here, or they're gathered in the Nurse Innovation Hub, mean to me. They have shown me through years of being hospital executive, from being fourth stage cancer patient, from being a 340-pound obese health risk. They have shown me, first and foremost, love. Second, they have shown me technology. Third, they have shown me lifestyle. And fourth, they have shown me pharmaceuticals. And I think about that in that order every single time. I am grateful to be here in my 60s, feeling like I did in my 30s. I want to tell you a little bit about my company because we are a startup. We were incubated during COVID, when every nurse felt like she was on the battlefield of something very ugly called healthcare. And every nurse went home feeling like she was at risk, not just for death, but total emotional exhaustion, total burnout. We were formed at the heart and genesis of this time by nurses who said there has to be a solution. There has to be a way to pull us up out of the gutter of COVID and into a future where nurses lead the way to preventive health care and overall well-being. There are two, and I put this up, these are the metaphors for the future of global wellness: being fat and having a heart that is failing, which is about, between those two conditions, 90% of the US population over 50. So we need to look at people, and we need to design all of this hectic, dare I say chaotic, work around people feeling bad, people feeling like health is too difficult. I have to pull my slides, so excuse me for this. But I've noticed, even in the midst of trying to understand what tech is, I've noticed this amazing shift. It's a paradigm shift in healthcare that all of us need to be aware of. Healthcare is not the light bulb. The light bulb does not light itself up, right? Healthcare instead is the electricity. It is the the non-tangible. It's the power behind the physical. The more we learn about human medicine and science, the more it becomes like neuroscience. My partner in this business is a PhD neuroscientist. We're discovering more and more that the etiology of all wellness and health stems from the electrical system that starts in our brain and heart and is a cycle in every cell in our body. Wow. So it's no longer medicines. It's no longer body parts. It really becomes, dare I say it loud, the software behind the hardware. I love the fact that Steve Jobs, rest in zest, was right all along. It's always about the operating system, not about the device that it's in. You know, people say he was fired by his board the first time when he said, let's stop focusing on the design of the computer. Let's start focusing on what this little phone can do. And it wasn't that little at the time. He said, this is the future hospital. This is the future grocery store. And they all thought he had lost it in his genius. But the truth of the matter is he never saw his company as a device. He always saw it as a system, as software. The other thing is that sleep changes everything. And that is something I've discovered here in Vegas. How many of you feel sleep deprived, right? Sleep changes everything and does not require surgery, medication, or hospitalization to achieve. I have helped physicians manage high, unmanageable blood pressure patients by simply putting a ring on their finger. And we love Samsung. We're being featured over in their booth, who's introduced a ring to the U.S. market. We love Ultrahuman, a partner in clinical studies with us. But what does that ring do? It allows individuals to monitor the intangible, the sleep, the REM cycle, the most important medicine that any of you can ever have in your life and learn from. The next really truism that I like to talk about is inactive lifestyle and negative stress response is the root of upwards of 90% of all chronic disease. This is a stat that you can see from the CDC, etc. But just look around you. The people in your life, your children who are most stressed are the ones that are most sick. One of the most amazing things as I was fighting advanced cancer and went to, and I always love to plug them, the Cancer Treatment Centers of America, the one thing I discovered there, which was just unbelievable, is the first thing they did is they said, stop breathing so rapidly. That makes cancer cells happy. And this was an NP nurse. She said, we're going to learn how stress can save you and how your reactions to the world around you help decide whether cancer cells multiply or cancer cells give in to a healthy body. Oh my gosh, that is just so exciting, knowing that stress can cure, not stress, a better reaction to stress can cure most chronic disease, as can getting up off the couch. Moving, although I have been moving. I had 14,000 steps yesterday. Oh my gosh, my legs feel like cement today. But moving is the secret. The other underpinning, and this is all less hardware, more software, is this. Cost-effective, non-invasive diagnostic and daily vital monitoring prevent chronic disease. And that's why I'm here. I want to help our nurses discover which of these companies out here have non-invasive, effective diagnostics as well as monitoring. That is, I had lunch yesterday with a young woman who won one of the prizes here, who has an app that helps to diagnose hidden endometriosis. Those are the kinds of powerful things that every woman affected by a disease that doctors can't find is going to be thrilled about. So these are my kind of 4 truths. The future calls for power-up health. The future calls for software Now, these aren't my principles. These are my guides. So and I want to tell you, Power Up Nursing works on three things. One, we have a platform, powerupnursing.com. You know what? It's a cottage website, but it works. We reach out to about 120,000 nurses every day. You want to get involved in it? Go on and contact us. But the second thing we do is we work with hospitals. Hospitals who know if you want to get something done, if you want something changed, if you want something improved, who do you ask? A nurse. So we are asking dozens of nurses that are a part of our team to go into hospitals and help them revitalize their nurse force. Not just revitalize it, but help their nurses reconstitute their bodies, become super resilient, and become professionals that lead the change in healthcare. We have a third entity that we're looking for financing for, which is amazing. It is freestanding community health collaboratives for people without insurance, run by nurses, powered up in the essential truths of software healthcare, meaning things like non-invasive, inexpensive testing, things like chronic care management, which is all over here excitedly. So those are the things we're working on. But I want to say that all of those things have this. They're integrated and personalized. We believe that we can craft a personal health and fitness strategy based on diagnostics, personal goals, and history. I'm going to just divert for just a second because I have in my day job, I have a chronic care management company called Treasure Coast Digital Health, and we just received new CPT codes. Now, everybody listen very carefully because this is changing healthcare. This is CPT codes from Cigna, one of the largest healthcare insurers in our country. And what they want is they want to start assessing physician practices. And how do they want to start assessing physician practices? Knowing diagnostics are done, certain medical pathways are followed, and that the patient is communicated and taught, and then that something good happened. And if it doesn't, what happens? Cigna is saying if you do not assess at a certain level, you will not be certified, which means we will not take and pay your bills. On the other side, consumers have to follow directions. Now, this gets a little scary. So, if I do not like statins because they make me dizzy and feel like I have Alzheimer's, I can't say no to my doctor without education and documentation because the doctor will get dinged. It is a very straight-jacketed type of medicine, or, like I like to look at it, a new communications-based medicine where we will talk with the patients for the doctor to make sure that his recommendations are heard and the patient has a chance to react. So I'm very serious about communication-centric. The future is communication-centric, and it can't be 30 different apps in your phone. It has to be one honest-to-God human being that helps that patient go through one or two apps on their phone, brings them in for health care, and helps them understand which medications are doing fine for them, and what of the 50 medications. Some of my heart failure patients come in as a new patient with 50 meds. They don't all work together, and they don't need them all. So we need to listen, read, watch, share, teach, learn, write. We need to cultivate provider-patient relationships. AI helps. I love AI. I am not an there were anti-vaxxers. There's now anti-AIers in healthcare. I love it because it does half of my job as an educator. It will take all of the blood pressures, all of the heart rates, all of the SpO2s, and it'll put it in a report for me. The past 3 weeks for Mary has been very turbulent. And at least I can begin a conversation by saying, what's been turbulent in your life? Or do you even know what that word means? Because I deal with a lot of very different kinds of patients. The third is measurable, and that's why everything at this digital health conference appeals to me. It needs to monitor your advancement, set the quantitative goals, track with technology, and modify the plan as needed. Lastly, I really believe that any healthcare, we're just about ready to announce our third annual symposium, which will be held in Miami. And I want to put the word heart in there because it has to be heart-driven. Emotions and mental health, stress resilience, energy, and social connectivity need to be advocated as measurable outcomes, just as much as blood pressure, HDL and LDL, and glucose. I will stand by that into the day I expire. So those are the software underpinnings of companies that we want to work with. Now, it goes without saying, I don't need to read this slide. I'm Power Up Nursing. I believe that nurses have not been trained to do acute care. Instead, nurses have been trained to heal. Nurses have been trained to nurse. Doctors have been trained to change a condition into something better, sometimes something worse. That's the very definition of doctoring. The very definition of nursing has to do with the art and science, and I'm going to use the big C word, caring. So, I heard this from Rebecca Love, who is one of the most brilliant champions for U.S. nurses right now. Did you know, even with losing 2 million nurses in the United States since COVID, we have more nurses than we have doctors, teachers, police, or firefighters in the United States. More nurses. Nurses will change the fabric of this country once organizations empower them. And that's why we are here, to power up nurses here on the floor of the future of healthcare, at hospitals as they serve bedside and in the boardroom, and then out in the community as they run their own community health collaboratives and demonstrate that even the highest risk populations can be radically improved in record time. How? Now I get to say, these two diseases cost about half of our U.S. healthcare budget. Obesity, which everyone thinks is some kind of human flaw, and we know more and more that it's a cellular condition that we start beating up when we're children, and we advance until a point where the hormones can no longer regulate appetite and just dietary processes, and obesity becomes a state of being. We need to look at obesity, and then, of course, heart disease, which kills everyone eventually, but really most 80% of deaths in the United States may very well be from preventable cardiovascular disease. Ladies and gentlemen, we can't treat the light bulb. Remember in the very beginning, that's the hardware. We can't treat that. The only thing we can treat is the electricity, the intangibles that flow through our body, right? Wow. This is a new concept, isn't it? That healthcare is humanity. Healthcare is about getting people to stop feeling hopeless, stop feeling disconnected, stop feeling anxious, stop feeling downtrodden, challenged. I would venture a guess. If I brought the average patient in here and said, "This is the world that's going to make you better," they would immediately leave. Because it's not calming. I want to talk about what we believe as Power Up Nursing are the 6 key principles that all of us need to think about. The first is movement and flow. Getting people to feel like they're practicing yoga when they're eating at McDonald's. What do I mean by that? We need to constantly keep people moving, and we need to constantly let people know that life is ebb and flow of energy. Sometimes that energy sucks. I just went through a bunch of hurricanes in Florida and tornadoes. That energy was horrible, but I knew that health is about low to high, high to low, moderation, and that's okay. And there are ways, these apps, some of them are amazing, that can help teach that and ground healthcare. The second, I'm sorry guys, human connection. How many of you just crave someone to come up to your little booth? You just want to connect with somebody. Here's a mint. You know, at this point in the conference, everyone just wants, you want a cup of coffee? You know, because we want real human connection, not just our brand, not just pass out a flyer. At a point, we all know, because I'm in sales. I've been in sales all my life. I've always been in development in healthcare. It never, ever is about the product I'm selling. I'm sorry. I worked at the very best women's health hospital in the United States for 12 years, McGee Women's Hospital, where I grew teeth for healthcare. And I will tell you, when I got $100+ million from Johnson & Johnson, thank you. It was not because I was at the best hospital. It was because I established relationships with my researchers, with my doctors, with my administration, with the same cohorts in that organization. And we connected. It's like that. You know, Sweden did this really cool thing. They went and they made all of their grocery stores without people in them. So you could go in, put all your groceries in there, go up, it would be scanned, you pay your bill, and leave. They decided that that was cruel and unusual for the elderly, because for most of the elderly, the only healthy moments and happy moments they had was going to that damn store and talking to the bag checker and the bag packer and the person that helped them outside. That's really sad, guys. But we need to think about that too. Where is your human connection in your products, in your practice, in your own life? I am convinced that there are scores that we can measure based on that. The third is resilience to stress and pain. I believe in embodied neuroscience. I believe that Dr. Rodriguez and Dr. Ramon, who are the co-founders of Somatic Functional Therapy, saved my life. Saved me from getting fusion in my spine, saved me from migraines, from MS, from all kinds of diagnoses, just by understanding that I can retrain my brain to solve all pain, because that's where it comes from. Pain is not a light bulb. Pain is electricity, and you can shut electricity off and on. Next is sleep and rest. I'm a huge sleep component. It is one of the healthiest prescriptions. And I really want to get every physician, nurse, provider a prescription pad that says, I want you to monitor your sleep, and here's what I need you to do. And I'm going to see it. I'm going to see it on a ring. I'm going to see it on a monitor that I give you, because sleep is the time where every cell in your body recalibrates. The next is prescriptive nutrition, and I'm having fun here walking around because we have tests. If anybody wants a simple test, a saliva test, you don't even have to go get blood. Send that off, and it'll tell you you don't have any vitamin D. One of the most critical, simple vitamins that help our immune system, keep cancer at bay, keep our stress levels down, help us sleep better. All you need is to know that you need vitamin D, and you need to have somebody prescribe a diet rich in vitamin D or chewable vitamin D enhanced with K vitamins. It's very simple. It's not about, I don't want to name any corporations, but it's not about writing down everything you eat all day long. It's not about any of that. It's about learning what your body needs to get leaner and stronger. And it could be prescribed. My doctor would have told me years ago, less bread, Tanya, and more barbecue chicken, which I know you love, but the less bread, I would never have faced 340 pounds as a woman. But no doctor addressed it. All they would say is, you're too fat. You're going to get lots of health problems. You're going to have estrogen dominance. But nobody was kind enough to talk to me about nutrition. Not that they weren't kind. They just don't know. They don't know. So we need to set up AI, virtual systems on how to recommend. One of my partners right now is a group called Bistro MD, designed by a doctor. So if you want a keto diet, you want a diabetes diet, you want a cardiovascular diet, they got it for you, delivered to your house. 3 meals a day, average $6 to $7 a meal. Way cool. That's what prescriptive nutrition is. And lastly, vitals monitoring. Vitals are what keep you alive, and every nurse, that's all they do. They know that. Temperature, heart rate, pulse, that is your indicator that you're alive. I look at my ring and it's like, oh my gosh, this whole conference I've been up around 90. My heart rate's always 58. That means this is stressful to me. As much fun as I'm having, as much as I'm learning, this is not good for my health. Sorry, organizers, but it's not. Being overloaded by all the sound. But I'm monitoring. And when I leave, I close the drapes in my hotel room, I do some box breathing, and I get my heart rate ready for bed. You don't learn that naturally. You need somebody to help you. So these, my friends, are the 6 principles of Power Up. Yes, they are data-driven. Yes, I need you. My nurses need you. I can't wait to kind of sit down after the conference and really think about who was here and how it all fits together. But remember, it's about human values first. And I know everybody pays lip service to that, but when you're in the middle of trying to sell your product, sometimes your product takes precedence. I'm just asking to really think about what your software is, not your product. What is it that you're giving to a human patient? Somebody who cries at night because they're in pain. What are you giving to alleviate that pain? That's pretty much it. Yeah, I just want to say that this is a little mission, if you will. It's not our official mission, but Power Up Nurses works with hospitals and partners that are dedicated to plugging people into a human values-driven model of care. And our goals are very simple. I want my patients to say, oh, Tanya, I have more energy, thank you. I want them to say, you know, I feel 10 years younger. This is vitality. My gosh, this is working. And lastly, of course, I want the measurements to be accruable. I want Cigna to say, effective healthcare will pay the doctor and cover the patient. I want all the same things you want, and we want to do it together. So this is 2024 group. We've only been around for a year and a half, almost 2. We are so excited. We are babies, but we're not. We are on the path to representing. At my old world was women's health care. I had over 300 hospitals as clients, helping them market women's health to communities. Now we're marketing the power of nursing to change the very fabric of a community, as well as to boost the performance and profits of U.S. hospitals, physicians, and nurse care providers. That's pretty much it. These are some books that I would love for you to read. This guy, he's like really cool, and he's one of our partners, but he's also a celebrity physician. The book is called Stay Off My Operating Table. The doctor is Dr. Avadia. I call his world the Avadia way. He wants you not to have surgery. He believes that the answer is in metabolic health. Once a year, have for $8, you can go into Quest yourself, have circulating insulin measured, measure your waist. His book is amazing, and it's inexpensive, and it changes everybody's life. Even the most conservative doctors have said, oh my gosh, how did I miss that? The next book is The Heart's Code. This is a researcher, an amazing man who's no longer with us, who researched for Stanford and MIT cellular hearts. And his, oh my gosh, synthesized meaning is the human heart is amazing. It is preeminent over the brain. You can live for years brain dead, minutes heart dead. Amazing book. The next is We Are Electric. This is by Sally Adi. Amazing book. It's about you're not a light bulb. You're all that flows within you. And then 2 more that are a little more popish but wonderful. The one is The Art and Science of Connection, just released. It is science about how connections between people can be cultivated so that your health measurably improves. And then lastly, Good Energy by Dr. Means. Amazing. Casey Means is amazing if you ever get a chance to hear her speak. But it is about how all medicine, all surgery, all chronic care management is all about balancing and restoring energy to the human body. So this is me, once again, Tanya Abreu. I am super, super proud that I gathered people to listen to me. It is hard. This is definitely a very distracting environment. But I hope if you hear anything, you hear that you can find me at Tanya at Power Up Nursing. And we are collaborative. We are essentially looking for partners to sell and build relationships to hospitals, to nurses, and to private practices around the country. And we have some interest globally. So thank you very much for your attention, for taking pictures of my presentation. I'm happy to send this to you. Thank you, Health 2024. This has been, no, we still have tomorrow. We have a little booth here, by the way. What's our booth number, Doctor? 20? 12. Booth number 12 in this pavilion. We're 2 rows over. Please come see us. Again, thank you and enjoy the rest of your time here at Health. Thank you.